everyone. My name is Solomay Tibabu, and I'm your host for the Going Digital Behavioral Health Tech Summit. And I am so pleased to have Dr. Julia Wright here, who is the Chief Medical Officer of Catasys. So thanks so much, Julia, for joining us. The first question I have for you is, you've been a senior leader at various health organizations over the years. What was your experience with members who have struggled with behavioral health issues, particularly ones that weren't seeking care?
Yeah, that's a really great lead-off question, Salome. Thank you for your insight there. And I am actually trained as an internal medicine physician, so an internist, and so my background in all of this really comes from my experience seeing patients in practice who have behavioral health conditions, either diagnosed or undiagnosed, many, many years ago. And so really starting off in outpatient care, inpatient care, seeing a lot of folks who were actually coming in with problems that were related to medical conditions that were probably not being addressed well enough because they had a behavioral health condition. And this is going back, a ways now. So it was really before we were giving the needed attention, which I'm very grateful that we are now, to people who have mental health conditions or behavioral health conditions. So, those were the patients who were able to come in and to get the care they needed. And it was a challenge, it was a challenge not having enough resources. It was a challenge sometimes not knowing exactly what the diagnoses were, trying to find, ways to get people included in services that could really help them, and just working with some of the challenges that are going on in, personal lives and, from what we call social determinants now. And that's really what I was deeply rooted in. And so I sort of had a passion and a heart for trying to reach people who have a mental health condition all along. And so, coming back to, what I've seen from the perspective of participating at a leadership level in care delivery and in health plans has been more of, witnessing that on a population level. So seeing what's happening with people who have mental health conditions and how they are or are not getting the care that they really need and how difficult that is to do. And there are so many barriers to that happening, really, which I think a lot of us are now familiar with, but not all of them have been solved. Some of them have to do with people having just access to care, of course, but probably even more importantly is some of these social issues that are not being addressed that really need to be fixed, maybe even on the front end before people are really even able to think about getting treatment or coming in. And then some of it, the barrier is really about the condition itself and how that plays out. So people who have mental health conditions, anxiety, depression, substance use, if you put anything in that bucket, and it actually overlaps with some other things. For example, pain and obesity have some similarities in this area as well, often have reluctance to see providers, see people to talk about those issues. A lot of it has to do with the very unfortunate situation that we still have with a lot of stigma. And unfortunately, that stigma runs deep in our culture and even includes providers and physicians. As much as we, would like to think that we've evolved on that, there's still a phenomenon there where we even bring some bias in from the medical community, not always, but often. And also people's own sense of perhaps shame or fear or some other things about having a medical visit, which happens to all of us, but maybe exacerbated, I think, for this population. So there's also some reasons that people might not get the care they need that are related to the disease itself. For example, people who have anxiety may actually, in some situations, may overutilize care, but not get the right care that they need because the anxiety is driving a certain type of visit, for example. People who are depressed may not have the motivation or the ability really to be able to get their needs met. So, and substance use disorder kind of runs the gamut. So that's really the kind of some of the issues that are all wrapped up into how we think about people who have behavioral health conditions and how we think about how they struggle or how people may struggle in getting needed care and attention. And yet I think at the end of the day, we should just be thinking about this as behavioral health conditions are medical conditions. It's just a different part of, the spectrum of medical. So that's really, I think, one way of kind of framing up what some of the challenges are And we've all seen the outcomes related to this. So all of the disparities and the problems that we see in people not getting treatment and, and it's becoming a growing problem as well.
Yeah, absolutely. And
Yeah.
besides just the practical background of clinically, this is what a lot of these patients or members are experiencing. You mentioned pop health earlier. I think more than ever, people are recognizing that people who are struggling with chronic disease and behavioral health conditions, for example, also tend to be the most costly to manage too.
Yes.
It seems
Yes.
to be.
Uh-huh. Yeah, and if you think about it, maybe from the population health lens, and one way of thinking about population health is thinking about all of the things that are contributing to a person's health and health outcomes. And so an individual who has a behavioral health condition is more likely to have a set of adverse circumstances possibly contributing to that or as a result of it. So again, those social situations and some of the demographics that we see and, maybe financial challenges or whatnot, ability to interact successfully with the healthcare system, and then there's the direct interaction between the behavioral condition and the medical conditions in the sense that the medical outcomes are worse. People often have chronic conditions with behavioral health condition. That happens anyway, but there's also a relationship where the behavioral health condition actually contributes or worsens the chronic condition. For example, heart disease, we know a lot about this, right? And so you end up with this whole kind of situation that makes it very, very complex and difficult to treat. And so we're kind of looking at that whole segment when we think about population health. And then it's the result of that that leads to the high cost. And that's where I think, fortunately, we are seeing some ability to start to address some of these things. And I've been very encouraged, having been on this journey for a while in recent times, that we really have a big focus on behavioral health and population health. And it's probably driven by that cost piece and trying to manage costs. But because of that, it's getting some due attention. And it's exciting to see the different ways in which organizations, people who are listening today are working on this problem and that it's a priority now. And, that's just such a, that is really progress. We don't all have the solutions, but we're doing some good things. And it might be the cost that's driving it, but these are people who really need help and they are sick. And that's the reason that we do what we do. So.
Yeah, I would agree. At least one hopeful aspect is just how many stakeholders are motivated to
Yes.
improve this area.
Yes.
Keeping on that theme with individuals who haven't been able to get care they need, particularly in traditional healthcare settings, how would you say care coordination and engagement plays a role in impacting them?
Yeah. The way that we think about care coordination and engagement right now, I think we're looking at trying to solve a healthcare problem, which is disparate care. People are getting care in different settings and it's not kind of coordinated. And that has to do a lot with the healthcare system, frankly. I experienced that directly when, as an internist, I went from seeing patients across the spectrum to just seeing patients in the hospital, which is what I do, in addition to this work today, I see people in the hospital. But that means that, the navigation through the system is very difficult and it's not continuous. And so the experience requires a lot of coordination. So I think that's an important thing to think about, that we're really working toward coordination. I believe that coordination happens best when it happens at sort of the individual level, where you're helping the person to get the care that they need in a coordinated way. And so it's a really kind of a different way of looking at the problem than to say, well, let's try to connect some pieces that are sort of not functioning together in the healthcare system. Well, let's re-engineer it a little bit and think about how we can do that piece of coordination and also really get people engaged in thinking about, their health and what is happening with their health in a way that's meaningful to them. And the people with behavioral health conditions, are certainly in that group. Health matters to everybody, and so it's a matter of kind of approaching the problem and being sensitive to what's going on with the individual who maybe has a mental health condition when you're thinking about these solutions. So absolutely, the engagement piece and the coordination piece is really, really important. I would also say, let's try to design some things that really solve for where a person is at and then meet their needs at that level.
Great, interesting. So you recently joined Catasys as Chief Medical Officer. I'm curious to hear, how is Catasys addressing this issue differently?
Yeah, that is a great tie-in. I am very proud, and for those of you listening who are doing this work today, very very proud to have participated and seen many folks who are doing a wonderful job working on this problem in care delivery and in at the health plan level. And we all know it's very challenging, and there's some limitations. There's great things happening, but there's also limitations. If you're a primary care physician, for example, this is a really tough problem, right? You need a lot of resources. Some people need some training. There's limitations on the availability of psychiatrists. Substance use treatment is just a really, really tough environment. As much as it's important and we're trying to fix it, just a lot of the resources and sometimes even the education pieces and whatnot aren't there. And then the health plan level, there's good programs being put together, I think, and good benefits and whatnot. But at the end of the day, the health plan ends up coming up with the same situation of circumstances. And so often the approach there is kind of it's by a trigger. Somebody gets involved in case management because an event happened or whatnot. So we think about all of that as the current environment. And I'm just giving some examples of kind of how people with a mental health problem may be getting their care and where they're going to get that, or who's reaching out to them. And then we know that there's this whole other group for whom they're not getting successful outreach. And part of it has to do with those things that we were talking about, or just not meeting those entry criteria. And, people coming into an office setting or responding to a phone call about a recent ER visit and a follow-up need or whatnot, just may not be reaching them in the way that's really going to be helpful. And so the idea that that Catasys has brought, which I'm proud to, be participating in now, is delivering those services to a person in their environment, but doing that first in a way that engages with people based on what their priorities and needs really are. So a person who has a anxiety or depression or substance use diagnosis, for example, will say, this is what's important to me right now in my life, or this is the biggest thing that is a challenge for me. If you start there and understanding what those dynamics are and what all is going on, and you can kind of walk with a person, it will lead to some opportunities to be able to connect people into the care that they really need. And so that's really, I think, the delivery of services to a person, kind of walking through at their pace based on their goals, and then creating an opportunity for people to get connected into care delivery, into health plan, into other services that we provide is the idea. And I'd like to share this because I think that there are elements of this that people are probably working on right now, and there may be some things that you can incorporate, from it as well. When you think a little bit about, how do I approach this tricky situation? What am I doing now that's working? What else might I need to be thinking about to help solve this problem?
Mm-hmm.
So that's one way of solving part of this problem.
Hmm. I see. So really, it's all about it's that relationship with their coach, that engagement and that trust building, and helps them navigate where they should go next, and making sure that it's the appropriate place for them.
Absolutely. And then, taking a approach to total health, which is not just the medical care, but also, but 2/3 of health is actually determined by people's behaviors and lifestyle, things that we do as individuals to contribute or, to the detriment of our health care, and also the social issues that are really, social barriers that really contribute as well. And so being able to address that holistically, or kind of together around an individual, with one person kind of coordinating, that coordination piece you were talking about, has been really, really valuable. So then as a person is ready, we can address, an issue with accessibility to food or transportation or whatnot. And then, help with the visits, or help with behaviors like, how do I start getting used to, smoking less, or how do I start getting used to maybe incorporating a little bit of exercise or better sleep and whatnot.
Mm-hmm.
So it's not a short-term solution. It's moving with a person as they're ready, and then bringing in things that will work along the way that connect to their goals. And I think that concept has been in healthcare before, and there are a lot of people who are thinking about that. That's what I think that's what primary care attempts to do, but maybe with all the resources around it.
Mm-hmm.
So
Yeah, that certainly helps it be a little more personalized, it sounds like.
Yeah, the personalization is so important. Yeah, yeah, so
Hmm.
important.
Okay. Well, I'd be remiss if I didn't ask how you thought about coronavirus and the impact on the members that you see, and
Yeah.
how that's impacted everything, really.
Yeah, hasn't it? And I just applaud you and everyone else who's participating for creating this environment for us to address that question. What has been happening with the SARS-CoV-2 virus, the coronavirus, in this environment, and how is that, impacting people who have mental health conditions. And I think we're going to learn a lot from each other through this. Like others, I think that we have experienced and seen both within our treated population or the members that we serve for health plans, we've seen really, shall we say, maybe an exacerbation or of all of the kind of underlying factors that kind of go into a person's emotional or mental health, leading to a potential for a destabilization. So the stress and the pressure and the inability to have social connections as much as possible, and actually paradoxically the lack of available medical care because of the virus itself. So I get a little concerned that it's been harder for people to access the care they need, both for behavioral health, but also for medical health. I think we've actually had a situation has caused us to regress a little bit in our ability to do some things on the disease management front and on the population health front because of the virus. And so it's all of those things kind of coming together. But if you think about that, while we all experience some of that, for a person who has, a diagnosis of anxiety or depression or something else on the behavioral spectrum, it's really going to intensify what's already a significant health issue. And so that's been the situation. I think we are all acknowledging that. There are despite some of that, there are some good things I think that are coming out of this as well. I mean, we've all been talking about the different ways that we're starting to help people to get access to care. And a lot of us have been waiting for the day when we can do remote services more often. That's something we've been doing at our organization for a long time. And so it's been extremely valuable at this time. And it's getting people a little bit more care. On the other hand, I also think, this whole thing about awareness and reaching out to people in a way, this extreme situation has put us all in sort of a situation where we can relate to each other in some areas that maybe, were a little bit harder to do before. It's been a bit of a normalizer or an equalizer for us. Oh, it's unusual for anybody to say, I've had no stress, no anxiety, no difficulty sleeping, no fears, that I have maintained my lifestyle the way that it was before, and I've had no, slipbacks or whatnot. So we're all experiencing that. And I think that awareness of kind of how we're all in this together in that way, can help us to destigmatize and relate a little bit differently. And that can give us a tremendous opportunity, I think, kind of post-COVID, if there is if and when that happens, I'm sure it will, post-COVID, to kind of take those attitudes forward and say, let's use this common experience to shed light on an important issue and help us to kind of progress a little bit more in the way that we approach people who have mental health issues.
Yeah, totally.
So I'm looking forward to that and to others who are contributing to that right now. So I think some things will stay. I'm hoping that, care opens up a little bit and people can get in for the care that they need. And I'm really hoping for maybe sort of a sea change here in terms of how we're opening up to allow people to talk more about this and to get the care that they need. Yeah.
You said something earlier that resonated with me. I think you and I both share the passion of helping folks get access to mental health care who aren't traditionally engaging with the system. I know that's with the healthcare system, and I know that's a big theme for Catasys. And with all that's going on with coronavirus, it just seems like, you and I talked about earlier that enrollment's been up just in light of people being answering the phone now and maybe having some anxiety going in. So I thought that was really interesting.
Yeah, I think that's a good point to layer in here, Salome, is that, people are struggling, but they also may be more receptive right now to focusing in on, what they're doing for their health and in particular mental health. And so hopefully this is time when people will be, because they're feeling a need and because it's really being kind of exposed and highlighted in a lot of ways right now, people may be open a little bit more to help and maybe open to participating in some services that might benefit them because they have the focus and the interest right now. So I think that that's one thing that might, also be an opportunity for us at this time. And thank you for bringing it up.
Mm-hmm. Yeah, not just with the healthcare piece, but even like the step before that, the social
Yes,
determinants piece. Like,
yes.
yeah, huge
The social
buzzword,
is
but
so important right now. And I think I probably didn't emphasize that enough as part, being part of this is that, the constraints where it comes to the intensification and really worsening of social barriers because of the economic situation, plus the social impact of COVID has really put us in an extreme situation where, we have so many more intense and probably more social barriers, social determinant type barriers going on for more people, which is just tragic. And so really intensifying those efforts, and that's, part of what we do. I know that a lot of organizations are doing that too. And so doubling down on that, I think it's a great opportunity right now for us to systematize the way that we're doing this.
mm-hmm. Yeah, speaking of systematizing,
Mm-hmm.
how much do you think do you think a lot of the new telehealth adoption, do you think a lot of the progress we made will stick beyond coronavirus?
Well, I mentioned that I've been, in care delivery for a while prior to this, and also health plan leadership. And so I think everybody here can kind of resonate with the fact that while we have been trying to introduce telehealth services and expand them, and I think almost everybody knows what the value of that is, it's been challenging on a couple of fronts. One is uptake and adoption within healthcare systems because changes are slow, and even sometimes provider adoption is a little bit slow too, for a number of reasons, and some of them are very valid. However, there's also some regulatory, barriers as well, in the sense of, if it's not being reimbursed, then it's probably not going to be, pursued. And so I think we've had movement on both fronts, right? So it's almost been like a springboard forward into adoption of telehealth by virtue of, the necessity of it. And really, I think systems pivoted much faster because they had to, put a lot of things in place so that it could be possible. And that was challenging for folks. But now that hard work has been done, I think there will be a lot of emphasis on sustaining it. And I think that there's a lot of interest in doing that, and that will be tremendously beneficial. The big question remains, how long will the regulatory environment allow that this can still happen? And so anything we can kind of do on a legislative or adoption level there that allows this good work to happen and doesn't regress again, I think will really make the difference in terms of how much telemedicine services we can provide.
Yeah, absolutely.
Yeah. So we're all keeping our fingers crossed and wishing for that.
Yeah, that's I've talked a lot about that on plenty of sessions so far, but
yes.
a good point that the investments have been made. So
yes, right. Yeah. All the things that are sort of the big barriers have sort of been overcome, I think, most places. And so now it's can we keep going with this and trying to figure out what the right balance is between direct care and virtual care. But, for a lot of the population, this is just a much more realistic way for people to get the care that they need. And I think that's definitely true for so many people with behavioral health challenges. So, yeah.
Absolutely. Yeah, that gives me a lot of hope, and I'm an optimist, but I think
Yes.
I think this is a really great start, and
Yes.
exciting to hear how you're addressing these huge problems in innovative ways, and everything from social determinants to access to behavioral health care. I wish we had more time, but we're already up. And so I have to thank you, Dr. Wright. It's such a pleasure. Everyone else, please stick around for the rest of the show.
Very grateful. Thank you, Salome. Yeah.